Hi, we're going over chapter 7 today in the Modern Dental Assisting book, and this is general physiology. So, physiology, you need to know, is the study of how living things function. So, it does continue beyond the study of anatomy into how parts work and what they do and why. So, let's get into the body systems. There are 11 body systems in the human body, and they are listed here. So, body systems don't operate independently. They exert important effects on each other. For example, if you exercise hard, your muscular system needs extra oxygen, so your respiratory system works harder than usual to supply it. So your systems all work together to make your body work. Your first system that we're going to go over is your skeletal system. It has 206 bones, and it works for protection, support, and shape, storage of certain minerals. For descriptive purposes, the skeleton is divided into the axial and appendicular skeletal systems. The axial skeleton consists of the skull, spinal column, ribs, and sternum. Its function is to protect the major organs of the nervous, respiratory, and circulatory system. So when you see a skeleton, the axial part of the skeleton is the trunk part of the skeleton. So the bones of the skull are the primary importance to the dental assistant. You need to know the bones of the skull so that you can identify different landmarks when you are taking impressions, pouring up models, and taking x-rays. The appendicular skeleton consists of the upper extremities and lower or shoulder girdle plus lower extremities and pelvic girdle. So your arms and legs plus the girdles that are holding those onto the body. It protects the organs of digestion and reproduction. So they talk about bone. Bone itself is the hard connective tissue that makes up most of the human skeleton. It has an organic component, which are the cells in the matrix, and an inorganic or a mineral component. The minerals are mainly calcium and phosphate, and that's what makes the bones rigid or hard. So it's essential that we have the right amount of calcium in our diet, and that is wise because calcium is constantly leaving our bones through our bloodstream, and we need to replenish that calcium in our bones. So the minerals are stored in bone, also act as a mineral reservoir to maintain essential blood mineral concentrations in times of inadequate supply in the body. So there are two different kinds of bone. There's compact bone and cancellous bone. So compact bone is the hard, dense, strong bone that forms the outer layer of your bones, and cancellous bone is lighter in weight. It's not as strong as compact bone and is found on the interior of the bone. So if you think about it, if you've ever had a piece of chicken and you've broken that bone apart, on the inside, that more web-like bone is the cancellous bone, and that harder bone on the outside is the compact bone. Bone marrow is the insides of the spaces of cancellous bone are two types of bone marrow. There's red marrow, and that's filled with blood vessels. It makes red and white blood cells and platelets. And then yellow marrow contains mainly fat cells, and that's found primarily in the shafts of long bones. So when we're born, we have only red bone marrow. As a person matures, that red marrow is mainly in the bones. It's replaced by yellow marrow. By adulthood, only about half of the bone marrow is red. Red bone marrow is found mostly in the ribs, breastbone, shoulder blades, collarbones, hip bones, and skull and spine. So the older we get, the more prone we are to infections because the amount of red bone marrow is decreasing. So we have fewer white blood cells and platelets in our body because that red bone marrow decreasing and it's filled with that yellow bone marrow. Cartilage is tough, but it's more elastic than bone, and it's found where your bones join together. It's non-vascular, meaning that it doesn't have a lot of blood vessels, so, or any blood vessels, so it's not going to bleed. And when it's connective tissue, and in addition to the ends of bones, cartilage gives form to the nose and ears. Areas where two bones come together are called joints. So there's basically there's three basic types of joints in the body. You're going to have a fibrous joint, and if you have a fibrous joint, it does not move. So the sutures of the skull are fibrous joints. So when you're looking at the skull and you see those little zigzag lines all over the skull, that's a fibrous joint. So it's not going to move. It is, it looks like it's like a crack or a break in the skull, but what it is where the skull actually was movable when the person was a newborn, and the skull all came together and eventually grew into one solid bone, and those are called sutures. So that's where the bones grew together. So those are fibrous joints where they do not move at all. Cartilaginous joints are made of connective tissue and cartilage. So that would be like between the bones of the vertebrae. And synovial joints, those are all your movable joints. So that's most of the joints in your body are synovial joints. Here you have diseases or disorders of the skeletal system. So in the skeletal system, there are many disorders, and a lot of them have to do with osteoporosis and osteoarthritis, but they can also have to do with a lot of other disorders. Make sure you're paying attention to these disorders through this lecture and through this chapter, because you are going to have a disease report and you're going to have to do a report on one of these diseases throughout this chapter. The muscular system gives us the ability to walk, stand, run, jump, move our eyes, smile, any kind of motion that we have is through our muscular system. We have more than 600 individual muscles, and they make the body move. And to do that, they have to work together. Each muscle consists of muscle tissue, connective tissue, nerve tissue, and vascular or blood tissue. So the main function of muscles are locomotion or movement of the body, holding the head up, movement of body fluids, production of heat for our body, and communication. So we have three different kinds of muscles. So the types of muscles we have are striated, smooth, and cardiac. Striated are called that because of the dark and light bands in the muscle fibers, and they give it a striped or striated appearance. So those are skeletal or voluntary muscles, and they're attached to the bones of the skeleton, and it makes the bodily motion possible. Smooth muscle moves the internal organs, such as the digestive tract, blood vessel, and secretion ducts, including some of the glands. So the cardiac muscle is only found in the heart. Cardiac is in the name, and you're only going to find that in the heart muscle. Contraction, the word contraction is the tightening of a muscle during which it becomes shorter and thicker. So think about it when the muscle's contracting, you're making that muscle stand up or flex. So it's going to be shorter and thicker. And then when you relax that muscle, it's going to return to its original shape, or it's going to relax, lay down. So it's going to become loose and longer in that relaxation phase. The muscles in the body are arranged in opposing pairs. So when one contracts, the other relaxes. And it's those contrasting actions that make motion possible. Origin, you need to know the word origin. That's where the muscle begins. So or the more fixed attachment of the muscle. So that's the end of the muscle that is closer to the midline of the body, or both. So muscle origin, that's where the muscle begins or originates. And muscle insertion, you need to know what insertion is. The place where the muscle ends or inserts into the body or the bone. It's the more movable end of the muscle, and it's farther away from the midline of the body, or both. So you do need to know what origin and insertion are. Here are some disorders of the muscular system. So these disorders of the muscular system can be found in your book on page 53, and they talk about, and they go into page 54. So there are a lot of different disorders that are caused by sports injuries, accidents, things like that, that happen in the muscular system. Cardiovascular system. It consists of the circulatory system, the heart, and the lymphatic system. They provide life-sustaining capabilities for the survival of body cells and tissues. So the main function of this system is respiratory, nutritive, and excretory. So breathing, making sure that we have enough nutrition, and then getting all of the, excreting all of the things out of our body that we don't need. So the two primary functions are transporting oxygen and nutrients to the cells and transporting carbon dioxide and waste products from the cells, as well as transporting hormones and antibodies throughout the body, regulating body temperature and chemical stability. So circulation is very important in our body to keep it in homeostasis, or good upper and lower parameters. Each day, our heart pumps 4,000 gallons of blood at a speed of 40 miles through 70,000 miles of vessels. So on table 7.4, there are disorders of the heart, and you can refer to figure 7.7 to look at the chambers of the heart and all of the different parts of the heart, where the right atrium and the right ventricle are, and the left atrium and the left ventricle, and look at the blood flow through the heart. The pericardium. The heart is enclosed in a double-walled membranous sac known as the pericardium. There's pericardial fluid between the layers, and it prevents friction when the heart beats. So this pericardium makes sure that there's not any friction within the wall or outside the wall of the heart, so that it doesn't, we don't have any friction in there, in any of the layers between the wall of the heart and any of the other organs. So the heart, it functions as a double pump. You need to know the right side pumps blood to the lungs, and the left side sends blood to the rest of the body. So what the right side does is it pumps blood to the lungs to be oxygenated. And then the left side pumps out that oxygenated blood to the rest of the body. The heart valves, there are one-way valves that prevent backflow of blood and separate the chambers of the heart by opening and closing with each heartbeat. So the tricuspid, note it is tri, so it has, it's found between the right atrium and the right ventricle. And then the mitral valve has two cusps and lies between the left atrium and the left ventricle. This slide follows blood flow through the heart. And blood vessels. Arteries are large blood vessels that carry blood away from the heart to all the regions of the body. So remember, arteries, away. Arteries are always going to carry blood away from the heart. V for veins, they're always carrying blood to the heart. So veins are carrying blood to the heart. Arteries are carrying blood away from the heart. And then capillaries are a system of microscopic vessels that connect the atrial and venous systems. So capillaries are just kind of hanging out in between their connecting those two systems. Plasma in our blood is a straw-colored fluid that transports nutrients, hormones, and waste products. It's 91% water, and red blood cells contain the blood protein hemoglobin that plays an essential role in oxygen transport. White blood cells, also known as leukocytes, so if you see a word and it starts with leuko, you know that it has something to do with white or white blood cells. It have the primary function of fighting disease in the body. This slide goes over blood typing and an RH factor. So when they do a safe administration of blood from donor to recipient, it requires typing and cross-matching. So they need to know what type of blood you have as a donor and what type of blood the recipient has. They have to do blood typing based on the antigens and antibodies found in the blood. And the most important classifications are A, B, B, and O. So that is the blood type. And then whether it's negative or positive is the antigen that is on it, if it's a negative or positive antigen. Patients who receive blood that is incompatible with their own may experience a serious or even possibly fatal reaction. So there is a universal donor that is type O and a universal recipient that is type AB. Other than that, only specific donors can give to specific recipients. With an RH factor is an additional antigen that's present on the surfaces of red blood cells in only some individuals. A person whose blood contains the factor is RH positive. If a person whose blood does not contain the factor, they're RH negative. Anti-RH antibodies are not naturally found in plasma as they are found in blood types, but they do develop if the patient is exposed to the RH factor. So if an RH negative mother gives birth to an RH positive baby, she will not have a blood reaction with the first pregnancy. But after the blood is mixed during delivery, the mother will develop an anti-RH antibodies in her serum. So a subsequent pregnancy with a RH positive fetus may develop erythroblastocytes, and if maternal anti-RH antibodies react with the fetal RH antigen. So that just means that if they have another RH positive baby that they're pregnant with, they would have to have a shot called a RhoGAM shot to make sure that nothing happened to the fetus. These are some disorders of the heart. So these are all very serious disorders and very common disorders that we hear of. We're going to go into the lymphatic system. So it's a system, it's a network of tissues and organs that help get rid of the body's toxins, waste, and unnecessary materials. So the drainage vessels absorb excess protein from tissues and return it to the bloodstream. Lymphoid organs contribute to the immune system to assist with destruction of harmful microorganisms. So if you look in chapter 19, there's a discussion of immunity and how it relates to disease transmission. Specialized lymph vessels called lacteals are located in the small intestine, and they aid in the absorption of fats from the small intestine into the bloodstream. Lymph nodes are small, round, or oval structures that are located in the lymph vessels, and they fight disease by producing antibodies, and this is part of the immune reaction. Major lymph node sites in the body include the neck, underarms, the lower abdomen, and in the lymph fluid. The major lymph organs are the tonsils and the spleen, both of which people can live with having them removed. These are disorders of the lymphatic system. The nervous system is in the communication system of the body. So we have the CNS, which is the central nervous system, and the PNS, which is the peripheral nervous system. The CNS, the central nervous system, is the brain and the spinal cord. The peripheral nervous system, or the PNS, is the cranial nerves and the spinal nerves. The basic function of a neuron is to direct communication or nerve impulses. The three types of neurons are sensory, motor, and associative neurons. In the central nervous system, we have the brain and the spinal cord. The brain is the primary center for the regulation and coordination of the body's activities, and each part of the brain controls different aspects of body function. The spinal cord carries all of the nerves that affect the limbs and lower parts of the body and is the pathway for impulses going to and from the brain. The peripheral nervous system, or the autonomic nervous system, controls unconscious activities such as breathing, heart rate, body temperature, blood pressure, and pupil size. The somatic nervous system controls conscious activities. If you remember from Mod 6, if you were here in Mod 6, somatic means referring or pertaining to the body except the reproductive organs. See, these are some diseases of the nervous system. So as you see, head injury can be a disease or a disorder. So there are a lot of things that are here that they can be a disease or a disorder. When we move on to the respiratory system, it delivers oxygen to the millions of cells in the body and transports waste product, carbon dioxide, out of the body. So this respiratory system consists the airway, the lungs, and the muscles of respiration. This list is disorders of the respiratory system. So they go from very minor to very severe disorders. In the digestive system, the role of the digestive system is to provide the body with nutrients, water, and electrolytes necessary for life. The digestive system functions under involuntary control. So its main function is to digest food, absorb the nutrients from that food, and eliminate the solid waste from that food. The digestive process goes from ingestion, which is when food is taken into the mouth. Digestion is the next phase. It's when the mouth begins in the mouth as food is masticated or chewed, which mastication is chewing. It's chewed with saliva and then swallowed. Movement is the next step in this process. The chewed food is subjected to peristalsis, the rhythmic wave-like contractions that move the food through the digestive tract. Absorption is the nutritional elements in the gastrointestinal tract pass through the lining of the gastrointestinal tract into the bloodstream. And then you have elimination, and that is in the large intestine. Solid byproducts of digestion are eliminated in the body or from the body in feces. Make sure that you know this process. These are the structures of the digestive system, so the major structures in the digestive system. And this is a list of disorders of the digestive system. In the endocrine system, it consists of ductless glands and tissues that help regulate the body's activities. The glands secrete hormones directly into the blood. These hormones affect metabolism, growth, and development, and are secreted directly into the bloodstream, not through a duct. These are our endocrine glands. Endocrine disorders, hypothyroidism, hyperthyroidism, and diabetes mellitus. In the urinary system, it's also known as excretory system. So it's the principal function is to filter blood and create urine. So we need to get all of the waste products from our body, and the needed substances are returned to the blood from our urinary system. So the structures are the kidneys, the ureter, the bladder, and urethra in our urinary system. So in our kidneys, that's where our urine is formed. The ureters transport the urine from the kidney to the bladder. The bladder stores the urine until it can be eliminated, and the urethra is the conduit which the bladder is emptied during the process of urination. These are some disorders of the urinary system. Integumentary system is the skin is the body's first line of defense against disease, and you need to know that. So people don't think of skin as an organ, but it is, and it is our largest organ, and it is our first line of defense. Functions of the skin system include regulation of body temperature, providing a barrier that prevents bacteria from entering the body, excreting liquids and salts, providing sensitivity to touch, and using ultraviolet rays from the sun to convert chemicals into vitamin D necessary for absorption of calcium. So our skin does a lot of amazing things. So this is the structures and appendages. So we have our skin, which is made up of the epidermis, dermis, and subcutaneous fat layers. And then our appendages, which are hair, nails, and glands. And we have 3 different types of glands: sebaceous, sudoriferous, and apocrine glands. So disorders of the integumentary system are listed here. Then we have the female reproductive system, and what is included in that is on this slide. Fertility, the normal function of the reproductive system, begins at puberty, the onset of menstruation, and ceases at menopause. These are some disorders of the female reproductive system. The male reproductive system produces and transports sperm, and this is what the system consists of. In the male, several organs serve as part of both the urinary tract and the reproductive system, and you need to know that. And disorders of the male reproductive system include this list. Thank you.